In this video, we're going to be demonstrating two-rescuer infant CPR. After making sure that the scene is safe and that we're wearing our PPE, we're going to check for responsiveness by tickling the foot. Then we are going to check for pulse and breathing by checking the brachial artery and looking at the chest and abdomen to get the impression of any breathing for at least 5 and no more than 10 seconds. Once I confirm that there's no pulse and no breathing, we're going to call for ALS backup and begin CPR. Begin chest compressions using the encircling method, performing now a ratio of 15:2. Now, while the compressions are being performed, I'm going to check the airway. If there are secretions in the mouth, we're going to suction the airway. Make sure to put the suction device together. We're going to be using a smaller catheter that's appropriate for an infant. I'm going to make sure to put it into the child setting to limit the amount of suctioning. Measure from the edge of the mouth to the earlobe, insert into the mouth and suction in a circular motion as you're drawing outward. Once the secretions are clear, I'm going to measure and insert an OPA. Measure from the edge of the mouth to the earlobe, insert it sideways. Being that it's an infant, I'm going to insert it sideways and rotate it 90 degrees. In this mannequin, it does not actually go into the mouth. Then we are going to begin by giving 2 breaths even before I connect it to the oxygen. Stop compressions. I'm going to tilt the head to a neutral position and give 1, 2. Now we're going to be continuing at a ratio of 15:2. Being that we're a two-rescuer CPR, we're going to be doing 15:2. So please count out loud. 1, 2.
4, 5, 6.
Now I'm going to connect oxygen
9.
in order to increase the concentration of the oxygen. Turn the oxygen tank on. Turn it up to 10 LPM.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
1, 2.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1.
Make sure to keep the mask sealed on the face the entire time and the head in a neutral position throughout the compressions.
13, 14, 15.
As soon as the defibrillator arrives, we're going to attach the defibrillator.
6, 7, 8.
We're going to be using the pediatric pads. We're going to have to stop the compressions in order to apply it because you're going to be placing it, as in the diagram, in the center of the chest and the center of the back. Center of the chest. Carefully turn the infant on their side while supporting the head and place it in the center of the back. Make sure to plug it in, turn it on, and follow the instructions just as you would in any situation when using a defibrillator. After the defibrillator is in place and you follow the instructions of the defibrillator, you're going to be continuing CPR by performing compressions over the defibrillator pad.